Your health is not a gamble.
One of the biggest problems in healthcare is, there's what we call information asymmetry.
I know the general understanding is ukienda kwa pharmacy, unaonwa na pharmacist, which is why when things go south,
The pharmacist.
It is your constitutional right as a Kenyan to receive the highest attainable standard of health. It's actually section 43(1)(a) of our Kenyan constitution.
We invest a lot of time knowing who the person who is serving us is, except at the pharmacy, which is a bit disturbing.
Patients do not like speaking up. You can go, they can even be suspecting something, but kuna hiyo uoga that comes with hospital and healthcare environments.
If you're suspecting something needs to be done,
Don't
don't assume the doctor knows everything.
When I was working in community, unapata mtu anakuja, they want 2 capsules of amoxil. Peke yake juu anasikia tu ako na hiyo kikohozi kidogo.
There's a myth that I would want us to demystify today. A pharmacist does not go to school to get a paper and read and just issue medicine.
For deworming up to 8 times in a year,
Welcome to Inside the Capsule, where we will be taking you beyond the label, beyond the prescription, and into the facts shaping your health for the curious mind who wants real answers and the confidence to take charge of their health. Hello, everybody, and welcome to Inside the Capsule podcast, where we make health make sense one conversation at a time. We are so excited to be bringing this podcast to you right from wherever you're watching us from, be it in your living room, in your commute, on the way home from work, or going to work as well. Even if you watch podcasts in the background when you're doing your work, wherever you're watching this from, thank you so much for tuning in, and we promise you it's going to be worth your time. So this is our very, very first episode. We are so happy. We are so excited. Even the guests here on set, who you are going to see soon, are very, very excited to be bringing these health conversations to you. And so what can you expect from Inside the Capsule? Here we are going to be unpacking health conversations, a variety of conversations from different angles. So you're going to get to hear from experts, you're going to get to hear from patients through their lived experiences. But one thing I can promise is no medical jargon, no complicated terminologies, just simple, real, relatable stories brought to you that you can be able to be educated from, be empowered, learn a thing or two, and maybe even just take care of yourself and your loved ones a bit better from the content you get on this podcast. So karibuni sana to this space. Welcome to Inside the Capsule. And without further ado, I want to now shift our attention to the guests that we have on set who are going to be setting the tone for this entire podcast. Shangwe na vigelegele kwa hawa wawili. We have the president of the Pharmaceutical Society of Kenya and the treasurer of the Pharmaceutical Society of Kenya. Karibuni sana. Are you happy to be here?
Very excited.
Mumefurahi. You're happy to be on set.
This is happening.
Finally.
Yes. So before we go further, before tuingie deep dive, I want you guys to take a minute to introduce yourselves to our viewers. Tell them a little bit more about yourselves. And I think I will start ladies first, okay? So we'll start with Dr. Wairimu. Please introduce yourself to our viewers.
Thank you so much, Sonia.
Yes.
My name is Dr. Wairimu Mbogo. I am the first female president of the Pharmaceutical Society of Kenya in 60 years. But other than that, I am a leader who happens to be a woman, and it's such an honor and a privilege to be leading a society, the umbrella body of pharmacists in Kenya.
Yes.
About who I am, first of all, I am a pharmacist by career. But other than that, I am a mom. I am a wife. I have worked across various sections of the profession. So I am one of those pharmacists who say that I have a holistic experience because I started off through the back end. I started off in distribution. Then I went into East Africa regulatory and business development management. Then I went into a company that is international, very globally renowned manufacturer, worked and also supporting English-speaking Sub-Saharan Africa region. I definitely worked in the hospital when I was very, very young in the government setting, left when devolution happened. And then now I'm an entrepreneur. So back to basics of, serving the patient at retail level, making sure that patients have access to medicines in the safe way. But that's just a nutshell. About me. So I have worked in the whole policy space and market access, and now I am trying to shift policy to make sure that patients in Kenya have the right to the highest attainable standard of health have access to the best standard of pharmaceutical care. So that is why I am the president of the Pharmaceutical Society.
Accolades upon accolades. Thank you so much, Daktari. Dr. Masibo.
What do I say after that?
What do you say after that?
What do I say after that? I'm the first male treasurer to the first female president of the Pharmaceutical Society of Kenya. But I don't know. I don't like introductions because I am very many things as well.
Yes.
And sometimes you forget to mention something and someone feels bad.
Yes.
I'm a pharmacist.
Yes.
I am a poet.
Wow.
And I am an Arsenal fan as well.
Ooh, so you must be very happy today on set.
We should talk about Arsenal a bit.
We should.
But what have I done? Like I said, I'm a pharmacist. I've been in healthcare management for a long time as well.
Yes.
I've been a medical superintendent for several facilities.
Yes.
I've been the county director for health for Trans Nzoia County.
Oh, nice.
I am the treasurer for the Pharmaceutical Society of Kenya. I am the chairperson for Kenya Healthcare Federation, one of the committees that deals with quality and standards. And I'm also a student. I'm a student right now. I'm studying my PhD in healthcare management. Yeah, so some pocket money would, send some money. Send some money.
Send some money.
Yeah.
Wow, phenomenal. Thank you so much for those introductions. I'm even learning some of these things about you guys.
You've not said everything.
You've not said it. You just chose the most important. Wow, phenomenal.
Yes.
Now, before we get into the topic, I want to ask you, because this is episode 1. This is something that has been cooking, and we are just so excited to be able to bring healthcare conversations in a simplified way, in a way that is accessible to the public, to every single person, because we are all possible patients at one point or the other. So maybe each of you can just tell me one thing you're excited about in terms of what these conversations can mean for the society and for people, and just being able to make healthcare conversations a bit more accessible to everybody. Yeah. Who will start? Who will go?
I think the biggest problem in healthcare, one of the biggest problems in healthcare is, there's what we call information asymmetry. Usually the providers or the medics know more than the patient.
Exactly.
And that's a big problem. So this podcast is coming in, to bridge that gap. That's how I see it. Secondly, I think the patients also do not have a voice.
Yes.
They have their own questions. Sometimes they have their own, concerns. So this is one of the platforms that we want as the Pharmaceutical Society of Kenya to give the Kenyan patient, the Kenyan citizen, a voice, to call in and ask about, what they don't ask about in the consultation rooms, what they might be fearing in terms of, just voicing whatever needs they have. So I'm really excited because that to me is giving the patients a voice and something to let them get empowered to discuss what they want to discuss with the healthcare profession.
With healthcare.
Yeah.
Phenomenal. Yes, Daktari.
I think for me, this is a dream come true. And I'm so glad that this podcast is coming in at our even within our first year of leadership.
Of leadership, yes.
Because we got in August of 2025. I would say end of July, August.
It's almost a year.
And almost a year now. And this has been something that has been cooking. But the goal of it, or the dream I had for Inside the Capsule, is for the public to get inside that capsule. Medicine is like a capsule.
It's like a capsule.
Yes, so I want you to get inside that capsule and get into the world of who a pharmacist is and what they do, beyond what you see or what you think at the counter.
Know. Yes.
Get to understand the different levels that we have, because we have pharmacists at basic, bachelor's level. We have pharmacists who are clinical pharmacists. We have pharmacists in factories. We want to take you through that journey of understanding how the medicine gets to you and why it needs to be the right medicine at the right place, at the right time, for the right condition, in the right space, and to ensure that it is safe for you to consume. So for us, we are offering a safe space for anyone from the elderly to the youngest. Ask us questions, bring in your concerns. We also want to challenge the pharmacists out there to practice and make sure that they are offering the highest attainable standard of health. By the way, I keep saying the highest attainable standard because it is your constitutional right as a Kenyan to receive the highest attainable standard of health. It's actually section 43(1)(a) of our Kenyan constitution that you have that right. And the Pharmaceutical Society of Kenya now is the umbrella body that has the experts who determine what that highest standard should look like. So within that, I know you will ask me about EPIC. So we are actually asking our pharmacists to practice in an EPIC manner.
Maybe you can just say briefly what EPIC is before we get into the conversation for today.
So EPIC is an acronym about how we carry ourselves and also the model or what we would call the modus operandi of how the Pharmaceutical Society works. So within the manifesto upon which I was voted upon, or why the membership felt that I could become their leader is because I promised them something that we called the EPIC manifesto. So number one, we want to carry that ethos because we believe by the time a pharmacist is leaving university, 5 years. 5 years, I know my years were crazy. I don't know how other pharmacists, but it was 5 crazy years. By the time you're finishing and you're graduating, you must be an EPIC human in one way or another. But also EPIC stands for Education, Policy, Innovation, and Collaboration. So education standing for how are we learning, but also how are we teaching. And this podcast is one of those situations where we are saying, this is how we want to teach the public and also ourselves about, harm reduction, public safety. So policy. Policy, we are not going to, we said that we are going to be unafraid. We are the ones who know what the highest attainable standard of pharmaceutical care is. And we want this country to move towards that standard. We are not yet there. And we're even below what it should be. So from a policy perspective, we are actually influencing decisions. And even recently, we submitted what you call a HCP policy, healthcare providers policy for pharmacists. What should the pharmaceutical profession look like? And what we're urging the Ministry of Health and even the government is to listen to us. Because if you're not listening to us, who's going to tell you what that highest standard is?
It looks like,
so that's policy and definitely influencing so many things. And, we had a conversation around, the impact of transport interference.
That has just happened.
That has just happened. And, the headache for me was what's happening to the patients who need their medication. Because hospitals and pharmacies order medicines every day. So if we have a transport interference, it means that we need to activate what you call patient-centered protocols that ensure that our patients are getting the right medication at the right time. So it's more of just public health policies that interact with the environment. Innovation is about the how. And now I know in this room, I know everyone is younger than me and Masibo. And we have to find innovative ways of how we execute what we're doing. We have to find ways of making sure that as we are executing our mandate, that we are making sure that we're also adopting to best practice standards. And then collaboration is basically we collaborate with everyone. We are here in this space. We don't work alone. The patient doesn't belong to one person. But we are here to make sure that the patient gets the best out of the pharmacist.
Wow, phenomenal. And to our viewers, all these things that you've heard the president mention, the EPIC framework, the HCP, they all have the patient in mind. It's all for the benefit of the patient, for you. When we say patient, we're not just talking about you, even ourselves. It's for all our benefit to be able to ensure that, like she mentioned, we are able to attain the highest attainable standard of health. So I think that's a fantastic place for us to kick off our conversation for today. And I want us to deep dive right now to engage to direct into what we are talking about. So our title for today's episode is Your Health is Not a Gamble. And we are contextualizing this in the space of pharmacies, because the chemist or pharmacy is the most accessible point of care for all of us. So if you think about it, anytime you feel sick, headache, unaumwa na tumbo, anything, the first place you run to is definitely the pharmacy.
Yes.
So before you even think, okay, maybe you can a pharmacy and you're given drugs and it's not working, you're not improving, that's when you're like, maybe sasa niende Husi, I go get like a proper review consultation. But for all of us, everybody, healthcare professionals, doctors, whoever, the first point of care is usually the pharmacy. And what we have seen even in the recent past is sometimes, on occasion, we have errors happening within these spaces, knowing that even healthcare professionals they're also people. And recently, I remember the other day, I don't know if you guys remember, there was something that was really blasted. It went everyone, I think, on Buzz Room. And there was this patient, this lady who went to get medication for her child. And unfortunately, she got dispensed to the wrong preparation. And it ended up significantly impacting that child. And there was public outcry. And who was implicated? The pharmacist. Of course, the pharmacist. And so I want us to set this conversation by, first of all, just providing a bit of clarity with an aim towards the safety of our patients, of ourselves. So I want us to begin by defining. It can be taken by any of you. Who is a pharmacist? And is every single person behind the counter when you step into a hospital, especially at the place where you're being dispensed to your medicines, a hospital, a chemist, or a pharmacy, is that person always a pharmacist? Let's seek clarity on that.
With the professor.
With Professor, PhD holder.
I don't know. One of the most disturbing things is for any other thing, whether it's dental, whether it's a surgery, we always invest in knowing who is the person going to take care of me.
Yes.
But when it comes to the pharmacy, it's like any person who is there will serve me, and I have, people even write their qualifications for everything else on the door. And by the time you're walking in, you know who is this person, what do they do.
Yes.
Even simple things like mtu wangu wa butcher, we know who they are. We invest a lot of time knowing who the person who is serving us is, except at the pharmacy, which is a bit disturbing because the pharmacist is the last line of defense in case anything goes wrong in the health system.
Yes.
So we review your medications. I keep saying whatever heals you can also kill you.
Facts.
There's a reason why we are regulated by a board called the Pharmacy and Poisons Board, because all medicines are poisons.
Yes.
And so I want us to get to a place where even the public invests in knowing who is serving me. What is your qualification? Which training have you received so far so that you're able to serve me? So the pharmacist, if I was defining the pharmacist in a way that anybody can relate to, that's the last line of defense for anything that can go wrong in the healthcare profession.
Yes.
If you get a correct diagnosis, then the pharmacist is there just to check if everything is fine and give you the best advice they can give you. If something is wrong, then they are the person who is going to get hold of it. So that is who the pharmacist is. Whether it's you're going for a very simple procedure or you are just exiting, most of the time you'll meet the pharmacist as the last person in that facility.
Yes.
And the kind of care you get there will define whether you got proper care or not. So that's for me how I will define a pharmacist. The last line of defense in the healthcare system when something goes wrong.
Fantastic. Dr. Wairimu, when I walk into a chemist anywhere, I go to a pharmacy, I go to a petrol station, nende mahali, and I want you to help us understand the distinction. Is it always pharmacist, pharmacist the title, or are there also other people that you can find who are also acting in that capacity? Because I know the general understanding is ukienda kwa pharmacy unaonwa na pharmacist, which is why when things go south,
the pharmacist
you get what I mean? So
and it's
help me just define and distinguish.
It's important to clarify and for the public to know, just like when you take your baby to hospital, you'll find there are places where you'll find a clinical officer.
Yes.
There are places where you'll find a medical officer. And also there are places where you'll find a pediatrician. and you will have a definition of that.
Yes.
And they are not the same
Yes.
because the level of training is different. So also in the pharmacy profession, the two main recognized cadres
Yes.
at the differentiation level, there's a diploma level where we have the pharmaceutical technologists. So they do a training for 3 years, mainly KMTC or many other colleges that are approved
offer
by the board.
Yes.
And then they will do an attachment after that and then get enrolled by the
Yes.
Pharmacy and Poisons Board.
Yes.
Then now we have the Bachelor of Pharmacy degree that is done by pharmacists. So the person who graduates from university, and now we have 9 schools of pharmacy. We call them the 9 universities of pharmacy in Kenya. They graduate and they become a pharmacist.
Yes.
So at practice level and at differentiation level, we have a policy problem.
Yes.
And it's important that we highlight that. Because by the time they're getting out, the diploma person and the degree person sort of has been assumed to practice at the same level.
At the same level,
So they can both open a pharmacy, they can both run what you call a chemist.
Yes.
But the Pharmacy and Poisons Board, who is our regulator, we are not regulators.
Yes.
We are policy drivers.
Yes.
I would say we are experts and policy drivers
Yes.
within the healthcare space.
Yes.
So the regulator has tried to differentiate. And how they have differentiated this, and this is very important, is that a pharmacy that is led by a pharmacist will have 2 green crosses on the side. But you also recognize that me saying this might prompt people to go paint green,
Akili
because
mtu wangu business.
yes, we are Kenyans and we are smart.
Yeah.
But the one that is led by a pharmaceutical technologist, which is a diploma holder, will have 2 blue crosses on the side. So today Kenyans, when you walk into a pharmacy, angalia juu, utaona itakuwa na crosses za green or
2
za
green,
blue.
and it should be in a place where it's visible.
It's in between the branding.
Oh, in
so
between the
whatever,
branding
yes.
of the
So whatever name of the pharmacy it is, it will be whatever pharmacy, 2 green crosses or 2 blue crosses. And for the Pharmaceutical Society of Kenya, we are going to be very intentional about making sure that the public knows who the pharmacist is and whether they're being served by a pharmacist or not.
Yeah.
The reason why this is important is because of consequence bearing. Because as a pharmaceutical society, we have an internal mechanism that's for self-regulation that is actually very strict. And it's so sad when we talk about medication errors happen. They do happen.
Yeah.
But it is not the norm. There are protocols upon which they should not happen.
True.
There are verification sequences that we usually have within a pharmacy to make sure that they are not happening. And even more importantly, we need to now start practicing, even like our neighbors in the other countries, where there must be a pharmacist at a certain point. And for me, it was an issue. There are people who felt very bad when that issue came out. And at first, when our due diligence had shown that this was not a pharmacist.
Yes.
Of course, it's human to now say, where are you? Mbona mnaruka huyu mtu? It's not about rukaring. It's about... It's about before media mwanza kusema ni pharmacist, jueni kwanza si pharmacist.
Yes. That's even in the papers. And they wrote pharmacist.
Yes.
Yeah.
Jueni si pharmacist. And we are going to guard our space selfishly. Just the same way lawyers guard their spaces.
Yeah. Different
professions will guard their spaces.
Yes.
And they'll say, mimi ni, I am a lawyer, I am a doctor, I am a pharmacist. Wacha tupatie tu tupatie hiyo huo mtoto mwenye alienda akasoma. Yani wazazi wakalipa 5 years.
1 year internship.
Waka-travel from sijui wapi wakaenda internship. Wacha tupatie tu daktari hiyo heshima yake na tusiite mtu mwingine hiyo jina if they are not one. But other than that, the Pharmaceutical Society is very keen on upgrading and making sure that the standards for the patient are met. So even after that incident, I know we invited the whole pharmacy profession for a medication error sensitization.
Yes.
We remind people that these are the things that you need to make sure are in place to make sure that we're keeping a patient safe. Yes.
Fantastic.
Yeah.
And maybe Sonia, there's it's important to know who the pharmacist is. I think she's articulated very well.
Very well, yeah.
Because we take responsibility for our patients as a society, and we want the public to know who we are. But also importantly, we forget that there's a third cadre, and these are the quacks. And there are very many.
They are a section that we must acknowledge because they are in numbers. They are like this.
The education is, you go to school to read about M-Pesa, how to receive money, how to pay through M-Pesa, and you're good to go. Yeah. And there are many. And what we are saying is we need the public to know who the pharmacist is. Especially the pharmacist, because the pharmacist is the peak of the pharmacy profession.
Yes.
And like I said earlier, you need to know who is serving you. Because a lot of people will just buy a butcher's coat, open a few shops there, and start selling drugs. Yeah. So it's important also to recognize that Kenya has a lot of people who are not even trained as well, practicing what we call pharmacy, but doing it very, very wrongly.
In a very wrong way. Yeah. Thank you so much for bringing that aspect, because it literally feeds right into my next question. Because you've talked about this third, let's call them third cadre, for lack of a better. You don't want us to call them a cadre. Okay. Okay, watu wa huko kando. The quacks. And now at a very practical level.
Yes.
Because we are trying, our whole goal and aim is to safeguard our patients from these people who masquerade as healthcare professionals and cause infinite harm on patients. Please, both of you can tell me, one of you can tell me some red flags people should be able to notice when you go to be served in a pharmacy, and you're like, you should, just small things that they can keep in mind and be like, if this is happening, definitely I should probably think twice or seek a second opinion or just go to a different facility. And then you can also give me like a checklist of be like, okay, when I walk into a pharmacy and maybe, the practitioner actually cares, is actually asking you questions about what is going on, not just shoving drugs in an envelope like this. Practical things that our audience can take away so that when they're being served, they can be on the alert to safeguard them. We can start.
I think for me, I say I think a lot, by the way, but this is what's on my mind.
Yes.
But it's important to let everyone know, and the public, we are not bystanders. We just don't watch things happen.
Yeah.
There is also a lot of pressure that we put on our Pharmacy and Poisons Board to make sure that we are cleaning up that space.
Yes.
So internally as a pharmaceutical society, we have people who we call sub-county pharmacists. And they are in every sub-county. And it's a poll on the ground, because we understand that sometimes our Pharmacy and Poisons Board, from an inspectorate perspective, they might not have the manpower, or the full manpower to be able to go to each and every corner. So one of the things that we are looking to utilize is our sub-county pharmacists. And today, I think we want to communicate that for the sub-counties that do not have sub-county pharmacists, but then we shall be coming to sort of ask, like, why doesn't this sub-county have a sub-county pharmacist? And can we help you recruit a sub-county pharmacist? That's number one. So this sub-county pharmacist, one of the things we are adding to them is that intelligence mechanism and requesting and working with the Pharmacy and Poisons Board to make sure that they're able to tell any pharmacy that is not licensed. And by the way, you can go to the Pharmacy and Poisons Board license website, ppb.go.ke, and you just look for license status, and you will get to know what is a registered pharmacy, who is a registered pharmacist, zote. Everything is in there. That's number one. Number two, as a Pharmaceutical Society of Kenya, we are now going into the next phase of making sure we are going to list the pharmacies that have pharmacists on our website. So now that will make it easier for the public to choose a provider. To get to check and verify, does this pharmacy does it have a pharmacist or doesn't it have a pharmacist? So that's one of the ways that we're doing. But also more importantly, because we don't have very many pharmacists on the ground, but this is because of the way the practice is. You see, you cannot get out of school and then you practice at the same level. You have a certain standard of practice. You're not going to give people certain medications, but then they walk into the next pharmacy and they get that medication. So that makes it a very hostile environment for a pharmacist to practice the way they have been trained to practice.
Yeah, true.
So we are now looking at ways of making sure that from a policy perspective, that we implement something that we call scheduling of medicines. Basically, each medicine has a category. We are saying there must be a scope of practice.
Yes.
For example, if you have a driving license, drivers have a scope of practice.
Yeah.
But they kama sina license ya boda, siwezi endesha
Always.
boda.
Yeah.
And I cannot then now take a trailer ama a lorry and start driving a lorry.
Yeah,
You know,
true.
my license allows me to drive a certain category of a car.
Yes.
Same way.
Yeah.
Depending on whether you're a pharmacist or a pharmaceutical technologist, it's about time we did what you call scheduling, just like other countries, where you have medicines that we call OTC.
Yes.
And even for that OTC space, I want to candidly say that there should be.
Tebu define for us OTC.
OTC.
Tulisema no jargon.
Yes, over-the-counter medicine. Basically, self-care, we call them self-care medication.
Yeah,
that's the best way.
Killers,
but you know,
some
ideally,
painkillers
it should
actually
be within limited quantities.
Yes.
It should be at limited quantities. Number two, even when you're picking medicine, even from like a supermarket,
Yes.
for a baby, there should be someone to guide you.
Yeah,
that
that's
this
problematic
medicine,
actually as
this
well.
medicine that you're picking for the baby, you need to consume it in a particular way. So we have what you call over-the-counter medications. Then we have what you call pharmacy only. That's Schedule 2.
Schedule 2 drugs.
Medication, which are a bit, they cannot really be over-the-counter, but they should be within a pharmacy.
Yeah.
But also the pharmaceutical technology should also have some leverage to be able to give it.
Yeah.
Then now we have Schedule 3 and 4 medications that must and have a pharmacist there.
Present.
The reason why I say this is because we are getting very high-risk patients who are walking into pharmacies, but they're not getting the right level of care. So you have a patient who has, unfortunately, it's becoming complex. You have a patient who has cancer, they have diabetes, they have renal failure, they have been seen by the specialist of the specialist.
Yes.
Please note that they see different doctors.
Yeah, for their different conditions.
For their different conditions.
Yes.
And there are different medications. The
Yes.
doctor is not an expert when it comes to the medicine, the chemical inside and how it works.
Yes.
And what it's going to do to the body.
Yeah.
We're the experts who understand the behind the scenes of how these medicines should work together.
True.
We don't want a scenario where now patients are still just being given medicines.
Evo too.
The pharmacist is there to make sure now that at the center of all these specialists you're seeing and all this medication that you have is what we are calling rationalization.
Yes.
We should even be able to de-prescribe your medication from you taking 10 to probably 5 and saying this is the optimal way that you should take this medication. But now what we have is that people are just getting medicines. And we're not measuring that output.
Yeah.
So those are the dangers or the conversations that we shall be now moving within this podcast to make sure that we are empowering the pharmacist, number one, and also the public to know
patients.
the role of that pharmacist and why they are important in the ecosystem.
Phenomenal. Thank you for that high-level policy understanding. It helps people understand.
Yes.
It helps us all understand
Yes.
what we are doing in the background to ensure that what lands in the hands of the patient is safe and efficacious for their experience. Dr. Masibo, nipe sasa vitu.
Very practical things.
Yes.
I think the president already talked about the Green Cross and the Blue Cross.
Yes.
I mean, you just have to see the cross, very practical. But like she said, tomorrow, someone can just decide to paint
quickly.
So that goes to the next level. So the Pharmacy and Poisons Board also has licensed every pharmacy that is supposed to be licensed. And it has a code. And that code is displayed on the pharmacy. So you text that, there's a number you text, and then if it returns information that the pharmacy is legitimate, then you can deal with it. So that is PSK, PPB. But there are things even the patient is supposed to look out for. The first one is when you present a prescription and someone is just dealing with the prescription. Not dealing with you as a person. So not asking you if you're on any other medications, your medical history. They're just interested in, dispensing. Probably it's not even your prescription, because you need to go and give secondary information to someone else. You need to understand it. So that's one of the clearest signs as well. Someone is just interested in that paper and not who is presenting this paper.
Yes.
If you go to a pharmacy and you see the provider is trying to push you towards a new diagnosis, or additional medication,
Yes.
chances are very high they're in for business.
Yeah.
And they're not really trained pharmacists, or they're not our members.
Yes.
Because our members are trained to rationalize prescriptions very clearly.
Yes.
If there's a problem, they will, try to deal with the prescriber and diagnose, and, give you proper care. But if someone is just pushing a new diagnosis and, telling you, I have this other medication that is not on the prescription, but you
Yes.
probably need it, that's another sign that you could be dealing with someone who is not properly trained. Yeah. So those are practical things that I think the patient can also look out for.
Yeah.
At the pharmacy level, when you're presenting your prescription, are they paying attention to what you're saying? Have they even asked about what else you're taking at home? Because
Yes.
medicines interact.
Yeah.
They interact even with food.
Yeah.
And it's a whole thing. By the time
True.
it's a whole
Using
ecosystem.
instructions, yeah.
Pharmacists are paid highly because they understand the medicine, and they're supposed to prevent any adverse effect that could happen when
Yeah.
you take the medicine.
Yeah.
Think about it from an IT perspective. Today, cybersecurity.
Yeah.
Why do we pay for cybersecurity? Because we know the cost of not having it,
Yeah. True.
right?
The
We
implications.
actually pay for digital security because we know if we don't do it.
True.
I think that's what we need to think about from a medication
Perspective, yes.
The pharmacist is your firewall behind the scenes. Like how strong is your firewall behind the scenes? So at what level of practice is this person?
Yes.
But even there's a myth that I would want us to demystify today. A pharmacist does not go to school to get a paper and read and just issue medicines.
Dish drugs.
Yeah. Pharmacists can actually prescribe.
Yeah.
They can actually prescribe. We actually go to school. We do all that pharmacology. Actually, we have like so much pharmacology in our brains. Pharmacology is how medicines work in the body and their interactions. Pharmacists do what you call clinical chemistry that allows you to ask for a lab test. If you're not too sure, there's no rush.
Yeah.
If a patient comes with a diagnosis, we also have very high referral mechanisms.
Yeah.
Like we know at this point, by the way, this is the time that this person needs to move to the next patient.
Yeah.
And that also now brings me now back to even our ecosystem of how we see pharmacists being very important and being underutilized. We have a lot of community health promoters because we are doing primary health care and we have primary care networks in this country.
Yeah.
But we want to offer ourselves
Yeah.
as the people who community health promoters can refer patients to for navigation, even for navigation purposes. If you're a CHP who is at home,
Yeah.
I want you to just find out within your town,
Yeah. Your
in the pharmacies, in your locality.
Yes.
Because you're going to homes, you're seeing people with diabetes,
They're the ones in
they're
touch.
hypertension, they're not even taking their medication.
Yeah.
Find out who the pharmacist is in that area.
that
and even
area.
our pharmacists, find out who the CHPs are in that area.
Yeah.
Let us work together and make sure that we are improving the compliance for patients. Where there's a referral mechanism that needs to happen, let's move that patient very quickly into the next framework because end-stage disease management is something that we want to intentionally reduce in this country. When you say end-stage disease, ni venye unasikianga mtu alikuanga na sukari, sasa kidney yake haifanyi kazi, anaenda dialysis.
Yeah.
We want to reduce that journey and improve the care at this point where the patient is diagnosed for chronic diseases.
Yeah.
So a pharmacist they just don't receive a prescription. They also prescribe, but within a certain level that we are defining and we're going to define moving forward.
Yes.
Someone said we go to school, there's a special font that we go to school to read about. Yeah.
Yes.
Oh, fantastic. Nice. Thank you for those very comprehensive answers. I hope you're picking things that you can actually implement when you are going to a pharmacy, to a chemist, things you can look out for so that you don't find yourself in trouble.
Yes. Even ask when you pharmacist. Uliza.
Yeah, actually, people can ask the
Yes.
And the challenge is many people that will just say, you try. Go and ask anybody.
Nipatie namba yako. Kuna namba.
MPSK number. Oh, mtu anaanza Yeah.
True.
All right. So I want us to pivot into something a bit lighter. Okay, just a bit lighter.
Yes.
You two have a lot of experience. Even your introductions were very heavy. You know, mmefanya kazi mahali mingi, and I know you've interacted with patients in a lot of settings: community pharmacy, hospitals. So I want our patients to be able, our viewers to be able to see themselves in some of these situations. So what are some of the things that you've seen patients do, either when they are sick or when they are seeking treatment, that just made you think, we need more education on this? I can give an example. Like when I was working in community, unapata mtu anakuja, they want 2 capsules of amoxil. Peke yake juu anasikia tu ako na hiyo kikohozi kidogo. And you know, those types of behaviors that a patient exhibits that you know are harmful for them, but they don't know. They intend well, and you realize we need to provide more education on this so that people are more aware. Yeah. So who can go? Masibo, I can see you have one.
You know, I worked, most of my working life has been in Western Kenya. I also come from Western.
Yes.
We have very unique behaviors. For example, for us, malaria inatoka kwa mvua. Ukinyeshewa, you know, you get malaria. So we have some peculiar behaviors
and
beliefs that I think we need to demystify. One of which, for instance, is you know,
malaria inatoka kwa mvua. That's hilarious.
One of the most profound things I've heard is the injection is better than tablets.
Oh, that one has been there forever.
Yeah, and they insist and they come and say, you know, I never get well when
nikimeza
dawa. And part of the reason is usually injections are usually for inpatient cases.
Yes.
You know, they cannot swallow or they are vomiting. So, you know, the injectables are preferred.
Are better, yeah.
And because there's that dramatic improvement from someone who is in bed and then they start walking and, you know, people associate the injection with that. So that's one of the things I think that is very profound.
Yeah.
For those people who use cold chain medication, so vitu kama insulin, unafaa weke kwa fridge. People don't know this. And a lot of people who have been on insulin for a long time, they do not know that you do not need to put your insulin in the fridge. So the one you're putting in the fridge is the one you've not opened.
Yes, the unopened one.
But once you start using insulin, it's supposed to be out because it's stable for about a month. Most of the dosages that those people are
for a month,
will go for a month.
Yeah.
When you put it in the fridge, two things happen. One is when you're injecting yourself, it becomes very painful. It's more painful than when it's not
room temp.
cold.
Yeah.
And then within that fridge, there are small droplets that also get into the vial. So you're basically diluting
your medication,
your insulin.
Yeah.
Yeah. So that's another thing. What else, Nimo?
Hata ametoa point ya kuwarm.
I think for me, Dr. Google has been the most absurd.
Yeah.
But I don't blame patients because we have reduced the trust level within our pharmacies.
Yes.
Because if you travel into other countries, there's that element of trust of the person who's at the pharmacy.
Yeah.
So we have patients who believe that they know and they know and they know, but we give them the right of refusal.
Yes.
Yes.
Yeah.
But I think with this awareness, it will help. With this awareness of who's serving you, who's behind the counter, will definitely help bring the conversation forward. Having scope of practice, having the government just clean up.
Yeah.
You know, even counties, but they wacheni kupatia na single business permit to someone who doesn't have a PPB license.
Yeah.
Can we just make that standard?
Standard, yeah.
Yes.
Yeah.
Yes, yeah.
Sonia, tumbo ikinguruma ni minyo. I think I've had that.
Hizo ni vitu za Western ama hizo ni vitu universal.
People are deworming up to 8 times in a year, you know, because nilideworm na bado inanguruma, you know.
Tumbo ikinguruma.
And even simple things like I don't get well when I use generic medicine. It has to be this particular brand.
I'm telling you that one even deserves an episode on its own because the
That
beliefs
one, we can't
around
deceive,
that.
Yeah.
So those are things I think such a platform is likely to help a lot. Just informing the patient on some of the myths that we have as patients as well.
Okay.
Yeah.
And fantastic. Naona hizo funny ni hizo za Western. I think I should practice pharmacy in Western a bit. I hear what's happening there. All right. Now, I want to still on just a bit closer to home because we're talking about people being proactive about their health and your health not being a gamble. You two as pharmacists, as doctors, I'm sure at one point or another you've been a patient, right? When was the last time you had to advocate for your own health as a patient? Be it in a pharmacy setting or a hospital, ulienda, and you had to speak up. Because I know one thing is patients do not like speaking up. You can go, they can even be suspecting something, but kuna hiyo uoga that comes with hospital and healthcare environments that even causes, it is a big barrier and a hindrance for patients attaining that highest attainable standard of health. So when was the last time? Give me a story of when you were sick and you had to advocate for yourself, because we really have to break those barriers of being unable to speak up for yourself. Yeah.
I think if I am to be very honest, even as we face the same barriers, because we have this Kenyan thing, we don't want to offend you.
You
know, we don't want to offend you.
Yeah.
So what we end up doing as us, we say by them ni daktari, so nipatie hii na hii na hii.
Because you have the knowledge.
We end up validating who we are and why we need something.
Yeah.
It's very rare that someone will go and lie that they are a professional and then that they need something, that they understand what they need.
Yes.
But to be honest, it is a lot of times that we have to keep checking and rechecking and validating. But also you don't want to make the other person uncomfortable. You don't want to make the patients around there uncomfortable. Because now if you make the patients around there uncomfortable, you're also embarrassing this person.
Yes.
But I think for me, I'll just stand by. Let us just improve the scope of practice.
Yes.
As the Pharmaceutical Society, help us. Come, let us know the challenges that you're facing.
Yeah.
And we shall internally deal with the issues that you could be having out there. But it's many times that we have to advocate for ourselves as patients.
Yeah.
But we use our secondary authority to make sure that we get things right.
Yeah.
Yeah. I think that's
fantastic.
what usually happens. Yeah.
Daktari.
To be honest, I don't think I've ever stood up for myself, which is very wrong, I know. I think it's worse for us professionals because you want to assume the other person knows well. But I'll give a story where, when I was a medical superintendent for Kitale County Hospital, something profound happened.
Yeah.
And I'm telling this story to make sure the patient always speaks out, even when you're suspecting something is wrong. It could be maybe just a suspicion, but you need to speak out.
To speak out, yeah.
So there's a patient who was in the ward, a child, and they wanted to draw blood for the laboratory. And so they usually tie something on the hand. It's called a tourniquet. It's like, the bladder thing, to make sure that the blood can flow well into the containers they use.
Yeah.
So they tied that thing, took the blood, and never removed the tourniquet. So the mother kept asking, what about this thing? You're supposed to remove it. And, everybody kept dismissing her.
She was asking the nurses.
Yeah, the nurses, the other people around, even the cleaners. And everybody was like, you relax, we'll get someone to do it for you. And she kept asking, and she kept asking. Eventually, unfortunately, that baby lost the arm. So it's one of those things where I think if you're suspecting something needs to be done, don't assume the doctor knows everything, because the doctors make mistakes.
Yeah, it
Pharmacists
happens.
make mistakes.
Yes.
And sometimes as a patient, you're able to see that this could be a mistake.
Yeah.
Please speak out. Speak out very authoritatively. Yeah, but I'm so ashamed that I've never really
You've never
stood, and I've had incidences where I could have spoken.
So you just go with the medication.
Yeah, most of the time.
You're just like, wacha tu nisi.
Wewe ni tibu tu.
Na hapo unashangaa na hii ni nini unanipea?
Yeah.
Thank you so much for that example. I think it puts into context what we're talking about, the importance of speaking up, because it can have that gut feeling. Don't ignore it. Don't ignore it. If you feel something is wrong, speak up until you get proper audience, so that you don't have something unfortunate like what happened there. We are now wrapping up. We are getting towards the end. There's just one thing I don't want, maybe one or two, but one thing I really wanted to ask, because last year in November, Dr. Wairimu.
Yes.
There was a statement that came out.
Which one?
And your name was on the lips of many Kenyans.
Which one?
Maybe you are being appointed as yes.
Your name was a household name. Pale Buzz Room, Pale SPM Buzz. I remember you released a statement, of course, on behalf of the Pharmaceutical Society of Kenya, condemning marketing, direct-to-consumer marketing of prescription-only medicines. And I think you remember how
yes. We didn't expect, that wasn't the goal.
You remember what it caused and how it came across. But it was very well received, actually, because I think the public had seen for a long time there had been this very unchecked marketing of drugs that should be highly controlled because of what their indications are, what they're supposed to be treating. And I think even now, which is why I want to get your thoughts on it, we're still seeing adverts of prescription-only medicines. Actually, last year niligongana na Black Friday deal ya dawa sita sema, and I'm like, vile kuna Black Friday deal ya microwave na fridge pale Hotpoint, pia kuna Black Friday deal. And I was like, wow. There's quite a lot of work to be done, but you came forth strongly and you condemned it, and it was well received by the public. What are your thoughts and sentiments around that? Just that marketing and how, what else are we doing? What else can we do to safeguard the public? Because it's our role to, they can't know. When they go to those clinics, when they're being sold for counterfeit products, when they don't know. It's our work from a policy level, from a practitioner level, to be able to protect them. So first of all, you can just tell me, what are your thoughts about that? And how are we going about to safeguard the patient?
I want to be candid and say that let's not let our financial advantages precede patient safety. Because many of the people who are marketing the prescription-only medication know that it's wrong to market it.
Yeah.
It's not a question of whether they know
the knowledge,
whether it's right or wrong. It is not right to market. Actually, it's against the law to market prescription-only medications, regardless of the benefits that they have done to you. Because we don't see people saying, oh, by the way, sukari yangu imeshuka na hii dawa ya diabetes. We don't see that. So it is being done to deliver a certain agenda.
Of course.
Targeted. And let us be, so for us and for the Pharmaceutical Society of Kenya, it's about harm reduction. There are so many other people who are receiving harm from the same medication that you're marketing. Number two, it also brings in loopholes for people to bring in falsified, unchecked, counterfeit medication.
Yes.
And for me, that is even the bigger risk. Because there's someone who will not probably maybe afford the proper genuine medication. I know the Pharmacy and Poisons Board has even released posters and everything. But we need to get to a point as Kenyans where we care for each other's health as opposed to what we are benefiting from what we are marketing. So if something is beneficial for you, well and good. Share your story, share your experience, but let not money be the preceding factors. Even for the healthcare providers, the doctors who are paying people to do this, please stop. Please
stop.
Please stop. I know it is a source of income. I know it is probably good money, but let's just stop doing that.
Yeah.
This is because at the end of the day, the sad thing is that when things go wrong in the pharmaceutical world, they go very wrong.
Very wrong.
And we discover it much later. And that's why I said, I was like, it's like your firewall behind the scenes.
Yeah.
But then you can walk around without it.
Yeah.
You can have a bank app and use public Wi-Fi to... But the reason why you don't use that public Wi-Fi is because in your mind there's the risk capacity where you're saying, I don't want to be attacked unnecessarily. Same case for medicine. So it is against the law. As Pharmaceutical Society, we are not going to stand for it.
Yes.
And it's very important that we clarify that we should stop marketing those medications. But other than that, we're going to have conversations around it, around around probably the topics that are being enhanced
Definitely.
within that. I'm
Definitely.
sure, Sonia.
Yeah, coming soon.
So we are not going to leave people hanging.
Yeah, we're not saying things and then we
we're not
don't.
going to leave you hanging.
Yes.
But let's just stop marketing
Yes.
and let everyone know that it is against the law. You can actually be arrested
Yes.
for it.
Yeah.
Yes. Yeah, you can actually be arrested for doing that. And I know Pharmacy and Poisons Board is they're doing their homework. Yeah, they're actually doing their homework.
When they crack the whip.
Yes. Yeah.
Yes.
Let's just stop doing it.
Yes.
Yeah.
Thank you. Masibo, did you want to add something?
I want to agree with her. It's all commercial. No one cares about the patient.
The patient.
In as much as they frame it like they care about you, no one cares about the patient. Obesity has now become, the new money mint. It's more expensive than the most expensive cancer to cure. You know. And then ask yourself why it only happens online.
Yeah.
Because if they really cared about you, there will be a physical shop and they'll be advertising in that physical shop.
Yeah.
Because they know the online space is a bit, fluid. You can easily get away with a lot of things.
Yes.
So I think just to reiterate, there's the only two people who can do a prescription for prescription-only medicines, the doctors and the pharmacists. Anyone else that's not their playing field.
Yes.
When you get a side effect, when those medications have an effect on you, those people cannot save you. You'll have now to go to the proper doctor. Yeah, so they do not. No one online advertising, marketing cares about you. They care about your money.
They want your money from your pocket. Yeah,
and that is why even the conversations, if you follow them closely, it's not about even the benefits. It's about it is now cheap. I can now get you at 50%.
That's why there's Black Friday.
Yeah, it's always about the cost and not the value.
Yes, phenomenal. Aptly put. Thank you for that. I don't have anything to add. I think we've dissected that perfectly. We are now at the final closing question. This one now, I want you people to just give short answers, okay? Just what is one thing, as we are closing and wrapping up this episode, what is one thing every Kenyan should leave this episode remembering that they are entitled to when it comes to their health? Just one thing, any that comes to your mind that they can leave remembering that they're entitled to.
I think for me, very short.
Yes.
The same medicine that heals you
Is the same
can
medicine
kill you.
Can kill you.
Yeah, I leave it at there.
Clock it. That one. That one is Instagrammable. Everything.
Yes.
Yes.
You have the right.
Yes.
And I repeat, you have the right to the highest attainable standard of health.
Yes.
You have the right to access the highest person who can give you the right medication for the right condition at the right time, in the right way, within the right condition.
Yes.
Highest attainable standard of health is a right for you within the Kenyan Constitution.
Yes. Phenomenal. This has been a phenomenal conversation. We hope you have learned. We hope you have picked one or two things that you can apply and practice in your own life. And one thing we want to call upon you to do is, if you have any question, we are going to have a running segment in every one of our episodes called #AskAPharmacist. If you have any question about any medication, any condition, and we're going to be having experts on these shows, please leave it down in our comments below. Or if it's a bit personal and you don't want it to be public, you can write a DM to any of our private pages. We are on Instagram at PS of Kenya. We are on Facebook as well. We will tag all of our socials in the description box, and you can be able to leave us a comment about anything you'd want addressed, and we'll be having a segment where we address common challenges and issues addressed by experts, so you can trust the advice that is going to be coming from this episode. So thank you so much for tuning in. It's been a joy and a pleasure to have you. Till the next one, we'll see you at Inside the Capsule. Bye. Say bye. Bye.
Oh, bye.